This is the United Healthcare website, and this is how things work here. So we choose find care and costs, choose specialists. We'll try a urologist, for example. So we're going to try to look for Dr. Tillem, which is what United Healthcare letter is showing us, right? 107. So we'll look by provider name. Here's the summary. It shows one number. No one knows what it means, 133 average cost in the area, but we're going to click on his name and see what it shows. So it has a tab services and costs. We click on it, and that's it. That's what it shows. Illnesses and conditions is one tab, and procedures and treatments is another tab. Now, interestingly enough, illnesses and conditions is not the type of service that complies with the health plan transparency regulations. Office visits are required to be shown, but it's hard to figure out what exactly this means. Is it a new visit, a follow-up visit? Why this visit is different from this visit? You know, these are very similar visits, you know, and UTI, bladder infection, is different from low testosterone. Who knows what they mean? Now, worse than that, there is no total estimate or insurance pay for any of them, and no estimates for out-of-pocket cost. But let's assume this is not something that is required by transparency rules. The transparency rules require specific services based on CPT description, right? So procedures and treatment is another requirement that are included in the 500 required services. All right, we'll go to a simple one. Cystoscopy, 52000. Right, so it shows average costs, you know, quite a range, 3,700 to 4,500. So we'll go for a full estimate. Let's see what happens here. So first, it shows for Dr. Tillem, it shows office or visit with a specialist for evaluation. Evaluation means evaluation and management code, such as a visit code, either a new patient or follow-up patient. It's $522, quite a bit. It's not clear what it is, but it's apparently not for cystoscopy, because cystoscopy is listed in the second part, and the only price that's listed is Flushing Hospital cystoscopy. What if it's done in the office? What would be the cost in the office? This is a procedure that usually is done in the office settings, usually under local anesthesia or IV sedation. For example, my office is certified as an office surgical facility. We can administer anesthesia by board certified anesthesiologists and perform minor procedures under anesthesia. However, it doesn't list the cost if it's performed in the office settings, only in a hospital. So when we change facility, and also it shows estimated total cost, right? So if you click average in your area, what it says is that you're seeing the average cost in your area for this procedure, because specific provider costs are not available or there are no affiliated providers. So this is not a negotiated cost. This is not a contractual cost. This is just average cost, which is meaningless to me. It doesn't list costs. It lists charges. I'm pretty sure the physician negotiated fee is not $11.88, right? So it lists the same number for charges and estimated cost. Same thing for facility. So it does not provide the actual negotiated rates. And then follow-up visit, you know, is again average in your area. It doesn't show the actual negotiated costs. If you try to change facility, the office is not available here. You know, this only shows surgical facilities and hospitals. All right, so we'll go back. So this is clearly non-compliant with the requirement. But let's try another urologist. Let's see what happens here. Let's try Dr. Berman. We click on services and costs, and now there are 3 tabs here, including one for office visits. However, only 4 services are listed for office visit. You know, high complexity, low complexity, moderate complexity, and moderate to high complexity. Now, it's not clear whether these new patient visits, so follow-up patient visits, there are actually, 9 codes for office visits, just for the office, not considering the consultation codes and other codes for office visits. So at least half of them are not even listed with descriptive terms. It's impossible to figure out what they means. But there is also no total cost, no insurance pay listed for 2 of them. One of them has estimated costs listed, but no estimate of what the insurance pays, or maybe 0. So maybe that's because of deductible. This has nothing listed, right? So let's go into detail on this. Moderate complexity. Let's go into this one. So what does this actually show? You estimate out-of-pocket costs, $153. So this shows estimated below average, right? Now, estimated total cost and estimated cost are the only costs that are listed for this visit. It's not clear if it's new or follow-up. There is no CPT listed here. Totally incomprehensible what it is. But let's go to explanation of costs. So allowed amount for network providers, this is called negotiated rate fee schedule, but nowhere does it say allowed amount here, right? So the only thing we see is estimated physician cost. Well, the estimated cost of the service before any of your benefits are applied. Also, the physician cost can be based on how it compares to average cost range for this service. It can be within this range or above or below it. So this is basically an estimate. This is not negotiated service. Right here, an explanation of costs, United Healthcare says that it doesn't display negotiated rates. If it did, it would be shown under allowed amount. There is nowhere here that it lists some allowed amount. Nowhere. Let's go to this moderate complexity. We can view here. We can search. So nothing anywhere that lists an allowed amount for this service, right? Nowhere here. So this is not an allowed amount. This is average cost in the area at best. Another violation of the CMS health plan transparency regulations. So for Dr. Berman, we see that under services and costs you have office visits listed. However, curiously enough, for Dr. Tillum, there are only 2 tabs. There is no tab that lists office visits at all, right? So why is that? Certainly non-compliant in many ways, right? So let's go into another visit. So this is a high complexity visit, right? Dr. Berman. It says estimated total cost. And when we click here for an explanation, this is what it says: average cost in your area. You're seeing the average cost in your area for this procedure because specific provider costs are not available, there are no affiliated providers. Now, certainly if there is a contract, right, there is a cost, there is a fee. So all of this is big nonsense, a lot of violations and non-compliance. I appreciate your attention.